It takes years until they seek treatment, and then something does not work, and then they are being left alone. And I think there in digitalization is the real potential. Once you have them, you can allocate them for them to the right treatment and see whether that works or not.
Patients who are underserved in the developing world and, you know, in countries like India or across Africa, what the role you see for digital therapeutics to play in really serving the mental health community there.
It's a huge potential. So because finally, we can scale evidence-based treatments. And that's really also our vision, to be able to provide treatments, especially in those countries who do not have an existing mental health care system. There's still a lot of countries where there is no state-of-the-art psychotherapy. But not only in these countries, as I said, Germany has one of the best mental health care systems in the world, but nevertheless, 81% of those with a disorder have not seen anybody in the last year. So I think really the potential, where I really believe in, is that you're able to reach people much earlier than any traditional mental health care system. And that's for me also important. Digital therapeutics are not the only solution, but the important thing is, once you have the user, so that you monitor him and see whether this was enough or not, and then you help him to access the right treatment for him. I've conducted around 40 clinical trials on both the prevention and treatment of mental health disorders for a lot of different disorders, and usually we find effects that are comparable to gold standard face-to-face psychotherapy. That means sometimes in depression 65%, meaning 35% do not respond. So, and then once you have them, so you need to help them to find the right treatment for them. But that's one problem in the healthcare system. Usually people are being left alone with them.
Somebody who is doesn't have that much money, who is in a vulnerable or marginalized community, generally, if they are not well, they go to their doctor. They're not going to be seeking out a health coach or a practitioner, because a lot of that it requires payment out of pocket. So in order for digital therapeutics to, really be able to do what we think it's going to do, which is make health in general more accessible and longevity more accessible to the masses, what do you think is needed?
Now, where I think the future lies and is completely needed for the success of this industry is B2P, so business to payer. And that's figuring out how insurance companies are gonna basically pay for those things. And once again, there are companies that are already working in that space and trying to figure out hacks on how to get paid. It's definitely not established yet, but that's where the industry is pushing. Now, with that, I'm gonna give you an example. Freespira is a device in which you basically exhale with it and inhale with it. And what happens is that it teaches you how to decrease your PTSD when you have very serious PTSD attacks. So the beauty of this is that if you have a PTSD attack, you don't know very often as a patient whether you have a heart condition or PTSD or something else. So a lot of those people go to ER because they are afraid that something else is happening. And that's $3,000 to $4,000 a month on average for an insurance company. Now, with that, Freespira can say, okay, if I'm saving you $4,000 a month, how much can you pay me? But that shouldn't be $10 because you're saving $4,000. And if you pay me enough that I can sustain my business, then it can be completely free for the patient. And it is. So that's happening with Freespira and many other companies that are basically trying to find different hacks and ways, once again, to be defined what's the way to get the payer pay for the medicine so that the patient can access it for free. And I think that's the biggest question, but also that's the future. Bye.